Time now for Doc Talk. We take your medical questions and get answers with local doctors. Today we are joined by Dr. Amy Cobb from University Health. Thanks for being here.
My pleasure.
Good to have you back.
Yeah, no, it's been a while.
Weeks.
Yeah. Okay, so our first question comes to us from Raul. He is asking, what are the latest recommendations regarding COVID vaccines for the elderly? I'm around my 84-year-old mother a lot. Is it a good idea for my mother and me to get vaccinated again?
So in the fall of 2023, they did update the COVID vaccine, and basically it's to target the XBB lineage of the Omicron variant. So it's just the most up-to-date for what's circulating right now. So for anyone over the age of 65, like his mother, it would be recommended to get 2 doses of the updated 2023-2024 version 4 months apart. So 2 doses, 4 months apart. Now, if Raul is under the age of 65, he would also be recommended to get a vaccine, but he would only need 1.
Interesting.
Okay.
All right, so atorvastatin is used for high cholesterol. And the next question is, I take atorvastatin, but my muscles have gotten very weak. I'm told I can't take anything else as I have 2 stents, 1 in each leg. Is there anything else that will help my cholesterol? And I think weak is spelled wrong on there, but you know, take W-E-A-K.
Right. So as you said, atorvastatin is in a class of medications. They're called statins, and they're for cholesterol, and they're highly effective and usually safe. They've been used by cardiologists and primary care doctors for many years. But in about 2 to 11% of patients, they can get a muscle side effect where they might have pain or weakness and so forth. Only 0.2 to 0.5% have a serious muscle reaction where it's so severe that the muscle breakdown can damage the kidney, for example, or cause serious muscle damage. So the first step would be to stop the medication until the symptoms go away completely. And then I would recommend talking to your doctor and seeing if there's another medicine you're on that might be making you more likely to react to the statin. So for example, there's a class of medicines called fibrates or niacin that can make the statin more likely to give you that kind of reaction. You should also be screened for some other conditions that can damage the muscle, like thyroid disease, kidney disease, obstructive liver disease, and even vitamin D deficiency. Sometimes if you treat those conditions and then you restart the statin, you can tolerate it better. Statins are broken down into high intensity, moderate, and low, and sometimes you can go back on the medicine just a step down, a little bit weaker, and then you can tolerate it. And I've also seen some people that if they take it every other day, they can still get benefit and they're able to tolerate it better. Now, if he is in that group that had a serious reaction, there are several other classes of medications that can be effective. So ezetimibe is one, and that one is like a blocker of cholesterol absorption. There are several others. There's even an injection that you can get from your cardiologist. So the next step, just talk to your doctor, see if any of those options would work for you.
Okay. Our next question is, I have a friend who was diagnosed with B-cell lymphoma. That's what this viewer wrote to us, asking what kind of cancer is it and is it treatable? What are symptoms to look for?
So lymphoma is a disease or a cancer of the lymphatic system, which I think of as like the germ-fighting network in your body. It includes your lymph nodes, your thymus, your spleen, and your bone marrow. B-cell lymphoma is one type of lymphoma. B-cells are an immune cell that help produce antibodies. And so symptoms of B-cell lymphoma can be things like weight loss, drenching night sweats, fevers, and enlarged lymph nodes. You might notice a gland that's very large. And then, you would go to your doctor, get some blood work, maybe a chest x-ray, CT scanner, biopsy. The treatment is usually chemotherapy, several rounds of chemotherapy. In some cases, they might need radiation or even a bone marrow transplant. But for this viewer who's concerned about their friend, what I would suggest is if they're open to it, offer if you can go with the newly diagnosed friend to the appointment, because a lot of times when you get that new cancer diagnosis, it's very overwhelming.
Oh, yeah.
There's so many technical terms and so many decisions to be made, and it'd be hard to even ask questions, And so would be my big recommendation, is just see if they would want you to go with them to the appointment.
Yes, somebody to lean
great
on.
Suggestion.
Yeah.
Sure.
All right. So the eclipse coming up on Monday.
Right.
What happens if you look into the eclipse without proper protection?
Yeah, so you can get permanent eye damage, actually. There's a couple things that could happen. One is you look into it, you can get a sunburn kind of on the outside lining of your eye, but you can get retinal damage that can be permanent and even cause blindness. So the recommendation is to use ISO certified, it's ISO 12312-2 certified glasses or viewers. Sunglasses aren't enough, they're just not strong enough. If you can't get those kind of viewers, there are, actually if you just go to the internet and you Google projector box. NASA, there's instructions with cardboard, aluminum foil, paper, and a pen, like a tack pen, that you can create your own box for this. And one other thing I'd point out is even if you have on the correct glasses and you're looking through an optical viewer like a telescope or binoculars, those optics can intensify the rays and it can go through those viewers and still damage your eyes. So you actually need a special filter on the end of the optical device.
Ah, okay.
And so symptoms to look for if you do get exposed during the eclipse would be blurry vision, feeling like grittiness in your eyes, white spots, headaches, those sorts of things.
Okay. I know our Sarah Spivey has created one of those pinhole projectors. I think she's got a how-to video on our website. They're actually pretty fun and super easy to make. So that's an option.
And if you can get your hands on the KSAT eclipse glasses, they are all those things that you told us about. The
2-3 something or other.
You got it.
Dr. Cobb, thank you.
My pleasure. Thank you.
I appreciate it.
Thanks for having me.
All right, want to show you the QR code now. If you have questions for our group of doctors, we would love to ask them. Thursdays at 6:30, it's Doc Talk. Hit this QR code to submit a question you have.